All right, well, let's stay on this topic and talk a bit more about everything happening with the coronavirus pandemic. We'll bring in Dr. Hilary Fairbrother, an emergency medicine physician down in Houston, Texas. Dr. Fairbrother, thanks for joining the program this morning. Let's start with what Anjalee was just talking about and kind of the scenes we're seeing down in Miami, and really just a nation that is reopening. As someone in the health system today, what are stress levels like where you are working, and how concerned are you that we will see additional surges in the hospital system, or are you confident that the vaccine rollout will sort of do what it's supposed to and keep that pressure on the health system at least somewhat under control?
So, good morning. And I would say it is pretty stressful for your healthcare teams to be watching spring breakers pretty much party with no consequences in mind. It's been disheartening, to say the least. This is a disease that has really outstripped our medical resources across the country. It has taken thousands upon thousands of lives, and it has stretched and continually stretches our healthcare teams, particularly on the front lines and in the ICUs throughout the country. So, to be so close to what I hope is a resolution of this pandemic, or at least a tempered resolution of the pandemic in this country, and to see behaviors like this is really, it is disconcerting and a little bit just frankly depressing.
Doctor, talk to us about what you're seeing there in Houston specifically, because there, of course, it was one of the early states to, although some states had never entirely shut, but Texas was one of the early states to entirely reopen, to say they were getting rid of the mask mandate. Have you guys seen a noticeable uptick at all? I mean, because even in places where we're seeing case counts go up, hospitalizations are not necessarily going up.
So certainly Texas was one of the first states to fully reopen and get rid of our mask mandate. That occurred March 10th. And I think it's a little bit early to tell. We're not even 2 weeks away. Wednesday will be 2 weeks away from March 10th to really tell what the effect of this change in policy has had. I can tell you what it feels like. It feels like we're at the very end of a marathon and we just stopped running. It kind of defies logic at this point. We're so close to potentially controlling this vaccine or controlling this pandemic with vaccinated peoples, and really watching our businesses rebound and watching people be able to live certainly much more free and open lifestyles, and seeing their loved ones and family after all of this time. And then to have been so close and to have opened in such a fashion was pretty heartbreaking, and certainly not in line with any of the medical organizations or physician organizations across the countries. And frankly, if you go into any hospital across the state of Texas, you're still going to be wearing a mask. So I hope that tells the people of Texas something about how they should be behaving outside of the hospitals of Texas as well. Right now, we're about 11% of Texans are fully vaccinated, and about just over 1 in 5 Texans have one of the 2 vaccines. We've just started, as the rest of the country, with the Johnson & Johnson, so we'll hopefully be able to get more of our population quickly, fully vaccinated without that 2-shot mandate. And we're all very excited. The vaccine rollout here has been nothing short of fantastic. We have basically given out almost 90% of the shots that are available to Texas. So we're not at the highest percentage by any state, but we are really doing our best to get any vaccines that we have available into the arms of Texans, so that we can really, cut this thing off at the knees and hopefully not see any more variants in this virus before we get to herd immunity, which again is about 70%. So we have quite a ways to go.
Doctor, it's Anjalee here. I wonder about overall, there seems to be, the public in general is getting a lot of information at one time. First, with the reduction of space between kids in school based on the CDC guidelines. But simultaneously, we're seeing that the CDC says we're still at a pretty precarious plateau in terms of daily case count. Could you address that in terms of how the public should be thinking about this? I know you stressed the mask mandates and continuing to use mitigation tactics, but are there places and ways that maybe it is okay to sort of let loose a little bit right now?
Certainly. So So still the number one thing that you can do to keep yourself and your loved ones safe is to wear a mask, socially distance, and wash your hands. I think that messaging has been consistent from the CDC, and that should kind of be the cornerstone of any kind of bringing people together as we kind of open up our populations. The CDC came out and said, people in the same household who are vaccinated, if the people who are unvaccinated are low risk, can certainly start to get together small gatherings. And I think that these kinds of events are important. People have been very isolated, especially our more at-risk populations. So if you and your family, if the at-risk people are vaccinated, and in my family, it's my kiddo that is still the unvaccinated one, feel free to start getting together in small groups within your household, as the CDC has indicated. And I think that, the more that we can get healthcare workers and the more that we can get childcare workers vaccinated, which is one of the populations we're really focusing on in Texas, we're really going to see kids back in school. I think what's tenuous that you asked about is that our lull in cases, we're certainly lower now than we were, say, last month, but we're not as low as we were in September, which was our last lull. And our high and our peak in January was much higher than it was in July. So we're not at a baseline number of cases that's exceedingly low in the community. In fact, we still had almost 1,500 new cases in Texas yesterday. So we've leveled out, and that's great. But our rate of transmission this week is back up to over 1. So that means that we are still seeing potential for increased number of cases. And with the loosening of the statewide regulations and spring break and things like this, we are worried that we are going to see another spike before the end of this. And of course, the more people that get coronavirus, the more chance it has to mutate, the more chance we have that our vaccines will no longer be as efficient as we want them to be against this disease. And then we spend even more time and energy trying to beat this thing back before we're done.
All right, Dr. Hilary Fairbrother, emergency medicine physician in Houston, Texas. Dr. Fairbrother, thank you so much for joining the program this morning, and I hope we'll be in touch.